we might go to air or start asking questions. I'm asking questions. Let's check out what's going on in the news. All right. Now let me grab the news from here. Yeah. Okay. I'll read a couple of news articles, and then we'll go straight to the COVID situation. Now, British Airlines have been banned from landing at Russia's airports and from crossing its airspace. The Russian civil aviation regulator has said, the move is in response to the unfriendly decisions by the UK aviation authorities. On Thursday, the UK banned Russia's national airline Aeroflot from landing in Britain. The measure was part of sanctions introduced following Moscow's invasion of Ukraine. UK Defense Secretary Ben Wallace said, I think that's their retaliation for us yesterday banning Aeroflot from using and landing in the United Kingdom. That's their tit for tat response. So I can see that coming. Or I could see it coming. Charities have urged the UK to welcome thousands of refugees from Ukraine, matching the effort made after the 1990s conflict in the former Yugoslavia. The UK should play a leading role in providing sanctuary. Save the Children and Amnesty International, among others, said in a letter to the Times. The US warned 5 million people could be displaced by Russia's invasion. The Home Office said its priority was British nationals and their families. Also in the news here in the United Kingdom, meanwhile, in sports, the Champions League final, has been moved from St. Petersburg, because of all the Russian-Ukraine situation, has been moved to Paris. I see. Now, turn to the news, to what we're going to be talking about, especially tonight. Around 4.7 million COVID vaccine doses, and that makes up 4% of the total, ended up as wastage in England by the end of October 2021. A government report revealed AstraZeneca shots made up 1.9 million. Wow. The National Audit Office, NAO, which scrutinizes spending of public money, say the wastage is far lower than projected for the country's most ambitious vaccination program ever. Experts have assumed 20% of stocks might not be used because of handling and storage problems or expiry dates. The report praises the rollout overall, but says there were challenges. So I come to Dr. Seshni. I say good morning to you, Dr. Seshni Wolia. Good morning. And welcome to Coffee Break.
Good morning, Opoku, and good morning, everyone.
You'll have to unmute. Ooh. You'll have to unmute your mic.
Yeah. Good morning, Opoku, and good morning, everyone. Yes, it's great to be on the show again on the Coffee Break, and the news is very interesting. You probably read my mind because that's the exact same article I was just reading before coming on air, where the millions of vaccine doses are destroyed in England. So, as you said, it's about 4% of the total of the vaccines. The AstraZeneca vaccine, there was also doses. So they're saying that this includes being left with too many expiring AstraZeneca doses after experts recommended that people under 40 should be given the Pfizer or the Moderna to avoid a very possible link to blood clots. So that's why we've had so much of AstraZeneca doses left, which obviously was about 1.9 million of those shots. So that has been destroyed. So there's been a lot of discussions. The head of the NAO program said that the vaccine program had been successful in the very early stages, and they secured a lot of supply and administered quite a bit. And he said that the Royal College of GPs, Dr. Gary Hosam, said that the health service had pulled out all the stops to ensure as many people were protected. So I think in terms of between GPs and community pharmacists, they've ended up administering many more doses than originally planned, so up to 71% up until the end of October, compared with the original of 56%. So I think what has happened is they had to try and get a lot of supply to, obviously, it was about supply and demand to fulfill the rollout program, the intensive rollout program, which was being promoted by, by Boris Johnson and the rest of the government. So I think that's probably what's happened. And they've had a lot of doses that were expiring that needed to be destroyed. But it's quite sad, because I mean, there's countries that some of them didn't have a lot of vaccines. So, surely these supplies could have been used by others.
Would you say that part of the problem, or part of the fact that all these vaccines wasted, is the fact that the rich countries were hoarding? We know that for a fact that there was a lot of hoarding going on with the very rich countries like our country, UK, United States, other countries who were hoarding the vaccines.
Yeah.
So would you say that this is part of the problem?
Yes, I think it was more that it was about the supply and demand. They obviously needed a large number of vaccines to fulfill the rollout plan. Prince Harry raised this, I think, earlier on in the year when he spoke about it, and he was urging the more richer countries and those that obviously were able to secure large, like millions of vaccine doses. He was urging that we needed to consider distributing it to countries which were probably the underdeveloped, and the countries that obviously the poorer countries that needed it. So that's why I even said that, probably they should have looked at distributing these vaccines, because that's over 4 million vaccines to destroy is a large number. And that must have cost a lot as well, the government a lot of money. But that is quite surprising news, to be honest. I wouldn't have expected so many millions of doses left over and then being destroyed.
Yeah. Well, I did have a feeling that something like that would happen, but not, like as you said, not that huge amount of vaccines to go waste. But they're saying that some wastage was avoided by redirecting 4.5 million AstraZeneca doses to other countries. Yeah. But stocks already at local sites had to be destroyed in line with regulations. Approximately 1.9 million doses were written off. So I don't know how this works. I wish we had a vaccine expert here to run us through this, because when the vaccines are manufactured, of course, everything has an expiry date, don't they? They all do have the expiry date. So when all these vaccines are manufactured, do they not know when the countries buy them? Do they not know the number of vaccines they needed, and as per their population? Or I don't really get it. Or is it just holding it so that in case? I don't know. I don't know.
I think it would be great to hear from a vaccine expert. But I think from the news, Opoku, what they're saying as well, as much as I mentioned earlier, part of the reason why they did destroy it was because the AstraZeneca had the risk of clots, the side effect, the rare side effects. So that's why it wasn't being used. So obviously, initially they thought they're going to, distribute and give people the AstraZeneca. But obviously, when it came out that there was obviously this rare side effect of blood clots, they decided that they were not going to give the AstraZeneca to those under 40. And so these doses were then left. So I think they probably did plan to use it, but unfortunately, because of the rollout of vaccines, because of the side effects and the concerns, they had to then destroy it. It had to be written off. So I think even if, like I mentioned earlier, if they could have given other countries, which they did do, but in terms of the AstraZeneca itself, it sounds like, according to the JCVI vaccine committee, they had to destroy these vaccines.
Yeah, well, then again, saying that, we're saying that they could have given these vaccines to poor countries and all that. But at the same time, if they realize that some of these vaccines have certain side effects and they're not 100%, then it's okay. They didn't give it to poor countries. You understand what I'm saying?
Yes. No, I totally understand. In fairness to the government, I think what they're saying is that they had a 8.3 billion for funding for the program, and it was going to end March 2022, which we're just approaching. And up to October 2021, 5.6 billion was spent on vaccines. So they actually, that's the amount. So they calculated it, and I think what another GP is saying, Dr. Nikki Kanani, the deputy lead for the NHS vaccine program, is at the National Audit Office, finding that the COVID NHS vaccination program delivered value for money, and confirmed that they knew that it was going to be the successful vaccine drive in health history. So they delivered it efficiently, effectively, and at speed. They vaccinated more than 4 in 5 adults with a booster and preventing more than 100,000 hospitalizations since mid-December, according to the latest data. So obviously there'll be a lot of more evidence, but it sounds like they have done an audit around the vaccine rollout and also the effectiveness, the efficiency of it, and the speed. And also, I mean, the fact that they managed to reduce NHS hospital admissions is amazing. I mean, over 100,000 in mid-December. So since mid-December. So I think that's really, again, it shows how effective the vaccines have been and how much they have helped save us and our patients and, you know, the communities at large in the whole world that has taken the vaccine. It has definitely, the evidence is there to suggest that taking the doses 1, 2, and the boosters have helped.
Okay, now let's come to testing.
Yeah.
We know that from the 1st of April, we don't get free testing anymore here in England, but free testing will continue in Scotland at some level beyond April the 1st, Nicola Sturgeon is saying. The Scottish Government is seeking clarity from the UK government about how testing is funded after mass free testing ends in England on the 1st of April. John Sweeney said Scottish ministers would set out in March how free PCR and lateral flow tests would be allocated. The Scottish Conservatives said Nicola Sturgeon should fund testing from existing budgets. We would say the same for England. Why don't they fund it from existing budget here in England?
That's the question on yours, mine, and everyone in the UK. I'm not surprised by Nicola Sturgeon. She's obviously managed the pandemic quite well, and she's always been quite, sort of democratic in the way that she's been managing it. And I think the fact that they still have free testing is great. So in England, as you said, the living with COVID guidance that has come out by Boris Johnson and 10 Downing Street, what they have said is that we are living with COVID to restore freedom, and as a result of that, there's an end of restrictions, so no self-isolating if you do test positive. However, the government is advising that for 5 days that you do need to stay at home. And then in terms of testing, there is no free tests from the 1st of March. So we will not be having any free tests. So, and also that, so you would have to buy your own tests. And I think, as we discussed yesterday, Boots will be having them for $5.99, Superdrug for £2. But in answer to your question, why is it still not free? We have been told that healthcare workers will be able to have the vaccines. So not the vaccine, the tests as well. So they will be able to still get tested if they are working on the front line. But in terms of what do I do if I test positive for COVID in England, the advice is those that test positive with COVID should stay at home and avoid contact with other people to reduce the spread of the virus. So the government states
that... They're advised to stay at home, but if they're not legally bound to do that.
Exactly. So the government states that stay-at-home advice also applies to those living in the same household or who have had close contact with someone with COVID-19. And it says you should avoid contact with other people. So if you have the main symptoms of COVID-19, which is a high temperature, a new cough, and a loss of change to your sense of smell or taste, or you've tested positive. So now they're saying even if you have symptoms, so you still need to consider avoiding contact. So they haven't made it mandatory and legally binding, but it's still there. So we're still back to where we started in terms of guidance. I think most people, even though it's not compulsory, will still be wearing masks if they need to. Even though the government has said you don't need to, they will be hand sanitizing, they will be maintaining social distancing. And obviously, the advice is that you should self isolate still. The advice is that you avoid contact. So they're not saying self isolate, they're saying avoid contact with other people. So if you're having a high temperature and you cough and a loss of taste and smell.
Yeah. I think we're digressing a bit. We just moved away from what we were talking about, Scotland and free tests and all that. Meanwhile, and in that same vein, the Deputy Minister of the UK, Dominic Raab, Deputy Prime Minister, later said Scotland had been granted an additional £6.5 billion to finance its COVID recovery. That's probably what they're going to be using to get free tests, give out free tests and all that.
Well, on the sorry for digressing, but on the rules for Scotland and Wales, what they're saying that if you do have symptoms, you should self isolate. So that's why they're still providing tests, because they are saying that you still need to self isolate and get a PCR test. And if you test positive, you have to self-isolate for 10 days. So obviously, this is in accordance with what the rules are in Scotland and Wales. And if you have a positive PCR or lateral flow, but no symptoms, you should self-isolate for 10 days from the day of your test. And Wales says if you have any of the main symptoms of COVID, you should self-isolate, take a PCR test, and if it's negative, you don't need to self-isolate. But if it's positive, then you need to self-isolate for 5 days, with day 1 being the day after your symptoms started or the day you've had the test. So obviously there's different rules for the two different places. For Scotland, it's 10 days. For Wales, it's 5 days. And you can see why they are still obviously providing tests. Whereas England, they are not making it compulsory to self-isolate. So the restrictions have ended yesterday. 24th of February, we've ended with restrictions that you do not need to self-isolate. And that's why there's no longer free testing for the public.
Yeah, but in Scotland and Wales, they haven't come out fully yet, have they?
No.
Just gradually doing it.
Yeah.
Right. Okay.
Just while we're on that,
I'm trying to find. Yeah, go on.
Just so self-isolation in Northern Ireland. So the guidance is that if you have symptoms of COVID-19 or you test positive for COVID-19 or you're in close contact, you need to get sort of tested. And if you test positive, you have to self-isolate for 10 days.
Okay.
Yeah.
Okay.
So it's just England that has taken this big step, isn't it? So they've taken this huge step, and obviously everyone's still. I think the title was "Living with COVID and Restoring Freedom." So I think it was about Boris Johnson and the government acknowledging that we've been through COVID, and in terms of the psychological impact, it's been huge on everyone. Going through the pandemic, living with COVID. Going through the coronaphobia and going through testing, going through losing loved ones. There's been so many psychological consequences of living with COVID, being in isolation, quarantine, lockdown, not being able to see families and friends, losing families and friends, people losing their jobs. There's been so many consequences. And obviously, I think the government made this decision to end restrictions on the 24th of February 2022 because of that they wanted us to resume normal life as possible. But I think they've also taken into consideration the Omicron wave, the evidence of what has been that it's not been as lethal as the SARS-CoV-2 and the Delta variant. It's taken into consideration the rollout of the vaccines, and also it's taken into consideration that the numbers have decreased and people are are also, I think what Boris Johnson is saying, that people are more responsible, and that the government is expecting that each of us, like you even suggested when we spoke earlier in the week on Monday, that it's each person's responsibility. So I think that's what they're relying on. So that's where we are at in terms of why England has made this decision.
Now, I've got just a story here. An investigation is underway at the Southern Health Trust after almost 200 people were possibly given an inaccurate COVID test result. Now, a trust spokesperson said it appears the issue may be linked to one bottle of solution used within the laboratory. At present, 193 people may be affected, which includes inpatients, staff, and tests carried out in the community. It is not clear yet how many were giving a wrong test result. If the wrong test result is not good at all, is it? I mean, can you imagine if you test negative, meanwhile you've got the virus, or the test result comes out positive and you haven't got it.
So I was
the waste of time and the waste of money and everything. It's just crazy.
I know, I was reading the exact same article as well, and it is quite surprising and shocking that almost 200 people were given the incorrect, inaccurate COVID result. So, and as you said, what it was related to. So it included the people that got the inaccurate testing were inpatients, with staff, and tests in the community. So it's not clear how it was given, but it seems that that they were given inaccurate results, which I think is quite worrying and concerning and shocking. So there's quite a lot of things to think about.
It's very worrying.
But in terms of there'll probably be an investigation.
I can sorry, before you continue, otherwise I forget what I want to say. I can tell you on authority that a friend of mine, he went to work, he's a health worker, he went to work, and of course you'll have to test before you go into the hospital. And he did a lateral flow test, and he tested positive. And he's an agency worker. He tested positive, and he was so sure that there was something wrong with it. And then he tested again, and he was negative.
That's strange.
And he tested again the third time, and it was negative.
Yeah.
He said I asked him, why did you decide to test the second time? He said, I don't know, but I got this hunch that something is not right.
Yeah.
And he tested twice more, and they were both negative. And ever since he's been testing every day, and it's still negative.
Yeah. So that was quite surprising.
That's the question.
I know that
he could have just gone home. The hospital would have been shot by one staff at least. At his own.
Yeah. No, that is quite surprising. So, I mean, I think it sounds like there's something to do with the test and the laboratory. So, I mean, they're going to do an investigation, so they'll find out more. But it is worrying. That's a large number. I think if it was like few people, I mean, but it was like over almost 200 people. And I mean, your friend as well.
Yeah.
That was good that he tested himself again, because obviously he was, he tested first positive and then negative. So.
He just said, I had this hunch that I should do it again. Yeah. And so he waited about half an hour later, and then he did it.
Yeah.
Negative. He waited another half hour. He did it. Negative.
Yeah.
And he was, when he was telling me this, I said, are you sure? He said, yeah, I'm very sure of what I'm telling you.
But that's good that he tested twice. So I think that comes to the reliability and this, the sensitivity and specificity of the testing. When we spoke about the lateral flow test and PCR very early on. So usually the tests are quite accurate, but obviously it sounds like with the news that we've heard and from what we've heard from your friend, it sounds like there is possibility that some tests have given false results. So the obviously further investigation into that will come into effect, and we'll find out more about that story. But I'm sure that people are concerned and wondering if, especially those that were in part of the almost 200. I just wanted to talk about Russia and Ukraine because of the coronavirus, in terms of the advice they've been given, because they've been protesting. So there were a large number of protests of people in Russia, and the advice from the government is that they should avoid protesting and getting in large crowds because of coronavirus. So so there's obviously the concern from the government in terms of what's going on in Ukraine, in Kiev, in terms of the recent invasion from Russia. So there's, it's as much as people are psychological impact of being in a sort of like a war type zone, they're also now concerned about COVID-19, which psychologically must be huge. I cannot imagine what the people are going through.
Okay. All right. I don't think we have anything more, unless you've got something else to add.
No, it was just.
Otherwise,
I was just talking.
Just do the numbers, Jenny.
Just about what the situation. There isn't anything globally that I can see that I read, but I think that, so in terms of Britain ending, the COVID testing and in terms of and restrictions and safety measures, there are people that are still concerned that if they do test, like sometimes if they haven't tested and they might have symptoms and they go out, so there might be, people are concerned that they might be going out and they might have COVID-19 and might be infecting other people. So, well, let's see. It's still early days. This has only just started on Thursday. So we'll obviously have to wait and see. I've not heard anything. I was actually looking for an update about the situation with health workers, whether they needed to get the vaccinations and whether there's been any decision made on that in terms of healthcare workers getting the vaccines, because there was a deadline, wasn't there, to get the vaccines, and then the government said that they were reviewing it. So I haven't heard anything. I don't know if you've heard anything in terms of.
No, I haven't. No.
Yeah. So I think probably in March or April we'll probably hear more. But I think what has happened is that the government realized that they were going to lose a large number of NHS workers, and it would have caused a burden on the NHS. So I think they've obviously reviewed it, but it will be interesting to know. It sounds like because of other issues going on in the world, we've not heard anything about this issue, which is important because in one sense, I'm quite relieved that obviously it is about pro-choice, but people have a responsibility, especially if you're working on the front line. But at the same time, I think I'm glad that for the people that haven't been vaccinated, that the government has obviously decided to wait on that. Yeah.
All right. Okay, so we do the numbers now, please.
Yes. Yeah, we'll do that. Just before, while I get that up, just to say that the Queen, we haven't heard anything more. I think the only news that I've read this morning is that she still has postponed all her engagements, and there's been further postponement of virtual engagements as she tackles COVID and has mild symptoms. But we haven't heard anything about any sort of treatment that she's been receiving or how she is. So I think all we know is that she has tested positive on the 20th and that she obviously has been able to, she's had one telephone consultation, I think, with Boris Johnson, but she has not been able to undertake any some of her virtual audiences this week. And she has mild symptoms, so still ongoing, and we wish her a recovery. So I'm just going to get the Waldometer figures. I don't know if you want to say anything else that you've read.
No, I don't. If you just wait, let's just do the numbers. Unfortunately, we're running out of time now.
Yeah, sounds like there's not going to be that much that we're going to have to report, isn't it? Like for over 2 years we've been doing it, and sounds like a lot of the everything seems to be sort of.
I'm glad we've got less and less to talk about with COVID. That way we know that we're getting somewhere, isn't it?
Yeah, exactly. So it's good news that things are looking a lot more positive. in terms of COVID-19. I hope it settles down in Russia and Ukraine, that their numbers don't increase because of what's going on, because, you know, obviously having large crowds and people in a situation like that, it's there is a warning that the COVID can spread as well. So in terms of the coronavirus update, as of today, the 25th of February, 2022, the figures on the Worldometer is 432,256,611 positive cases. Total number of deaths is 5,949,540 total number of deaths. And then the total number that have recovered, let's get that for you in a minute. So there's still a large number that has recovered globally.
361 million, that's what I'm seeing now.
Yeah. I think my computer's just taking, if you want to read it, so long. So it seems to be.
So you want to read it? Huh?
Yeah, if you can read it. So yeah.
Right. So total covered is stands at 361,506,039, and the top five still stands the same, with the USA with total cases of 80,446,580 and 969,602 deaths. India is number 2 with 42,894,305 total cases and 513,258 total deaths. Brazil is 3 on the list with total cases of 28,580,995 and 647,486 deaths. Number 4 is France, with total cases of 22,534,971 and 137,770 deaths. And then to us, UK, total cases of 18,773,164 and total deaths of 161,104. So we move to South Africa, yeah?
Yeah.
Where is it? Where is South Africa? Oh,
it's number 20.
Oh, there it is. Yeah, number 20. Total cases of, I clicked on something that I shouldn't have clicked on. Sorry, forgive me. I'll get it.
No, that's fine.
Oh, there you go. It's popping up again. You know what computers are like. Once you go back, and then it will take you some time to get it. Come on, behave yourself. Yeah. Okay. Where were we? South Africa, yeah? Oh, goodness. It's still loading. I don't know why this computer's going slow today.
So I had the exact, I was having
the exact. Just keep going, yeah.
No, I've got it. So I've got it now. Sorry, I had some issues as well. So thank you for filling in. So South Africa's number 20 with 3,667,560 positive cases, and with 99,018 deaths. And then Ghana. So yeah, just above that. So that was South Africa. And then we've got Japan number 19 with 4,750,496 with 22,755, and Ukraine number 18 with 4,809,624 with positive cases with 105,505 deaths, and Ghana is quite low on the list. I think it's now 110 with 159,124 positive cases and 1,442 deaths. And if we look at the UK, the 24-hour figure, the numbers are going down. So even though the restrictions, the guidance has changed, we are still seeing the numbers go down. So in terms of COVID-19, the figures as of the last 24 hours, so we know that our total figures are 164. Positive cases, total number of deaths is 161,104. And in terms of the last 24 hours, it's 38,933 new cases with 125 new deaths. So every life matters. We still continue to see numbers. So stay safe, everyone. Let's spread the love and not the virus, and adhere to whatever guidance that you are following in terms of the government and in terms of the World Health Organization. Thank you so much, Opoku, for having me on the show.
Thank you very much, and have a fantastic weekend.
You as well. Have a lovely weekend, and the sun is shining where I am. I hope your weather on your side is much better today.
Well, it is. I can see the sun's coming up now, so yeah. It's not yet. It's not weather yet for Brian, but hey, we're getting there.
I'm tempted to
anyway,
say
thank you very much.
I would still braai or have a barbecue in this weather, and just to say our thoughts.
Oh yeah.
Thanks. Definitely.
All right. Okay.
Thanks. Have a wonderful day. Bye. Thank you everyone for watching. That was me with Opoku Opare on NHS Hospital Radio Bedford, just doing the COVID-19 update and the psychological impact. Stay safe, everyone, and our thoughts and prayers with everyone that's in Ukraine and in Kiev, and hope everyone stays safe. Thank you very much and have a fantastic weekend. Namaste.